Hello everyone. In this video, we are going to talk about Braden scale. This is something that every nurse needs to understand when assessing a patient risk of development, pressure injury, or any kind of bed sores. So let's understand what it exactly is and why we normally use this. So the Braden scale is a checklist for nurses used to see how likely a patient is to get the pressure injury, or you can say bed sores, right? If someone is in the bed for a very prolonged period of time, then there may be some kind of uh, probability of getting a pressure sore. It's because when they are there for a long time, the skin can break down because of the pressure, and there will be a injury that normally we call as pressure injury. Now we also try to make sure that people are not getting pressure injury because of the condition that they have. So let's go through this. So this is basically a checklist for nurses to see, and likeliness, it is a likeliness of a patient to get pressure injury, which is bed sores. So the most common areas of patient getting this pressure sore are back of the head, which is occipital, also shoulder, elbows, spine, hips, knees, coccyx region, and heel. So these are the reasons, places where there is more likely of a pressure, and there is also because skin and tissue are in between and the bony area, and because of that reason the blood flow is being reduced there and the tissue dies, and because of that it causes things like pressure sores. So there are six assessments that we normally do, which comes under the Braden scale, and we keep in mind while we are assessing this. So first comes sensory perception. So what sensory perception is can they feel any kind of pain or discomfort, or if no, they won't make any kind of source, right? So we are asking them about what sort of pain or discomfort they are feeling, and we will rate them out of 4, and 1 being the least and 4 being the highest. And once we did it same thing with the all of these, we'll add it and we will judge the final assessment according to this outcome. So now let's move to moisture. So moisture is basically, is the skin often wet from sweat, urine, or wounds, or like is there any reason for the skin to be break easily? So we can see like people are in incontinence ad for a very long time, so there might be a high probability that they might have a some form of pressure injuries, right? So we have to monitor that according to that activity. So activity is, are they walking, sitting, or lying most of the time, or they are not moving or being in the same place for a very long time, right? Some people are bed fast, some people are chair fast, some people can walk even though they have some condition. So according to that we have to judge similarly. Now we have mobility. Mobility is like, can they change position by themselves, or they need some assistant, how much assistant they need totally assistant or just partial assessment. So we have to do according to that. Now let's move to nutrition. Nutrition is the, are they eating well, how much they are eating, they are not eating at all, or they are eating just little bit, adequate, excellent. So we have to do the rating out of 4 here. So for friction and shear, it's like, is the skin rubbing or sliding on seats? So when they are changing their position or repositioning, is the skin of the patient being slide, or are they rubbing their own skin with the seats? If they are doing that, there might be a high probability that there might be any kind of skin tears, because first of all their skin are very vulnerable and very weak or easy to tear, so that might cause a high probability of being skin tear. So we have to judge out of 3. So this is, we are doing out of 3. Now we'll add all of these marks, and after counting all the marks, we can see there, if the number is less than 9, then there is a high probability of being pressure injury, and we have to make nursing intervention according to that. And we have high risk, that is 10 out of 10 and 10 to 12. Moderate risk, this is 13 to 14, and mild risk is 15 to 18. So these are the whole idea of how it looks like, and I will give you another whole idea on a how to do the Braden scale pressure sore on a patient, and I will bring a chart with me so it's easier for you to, because there is whole chart that you have to do. And let's give you, I will give you an example of how pressure injury is done. So let's say there is a older patient. Let's say there is an older patient and they can't move, okay, and poor nutrition. So this is the statement, right? And incontinence aid, right? So that means can't move, that means the man is chair fast, right? So that means the pressure injury is 1. Poor nutrition, 1, right? Incontinence aid, that means their moisture might be 2. And older people, so they need some assessment. And sensory perception, that means very limited, so 2. So 2, 3, 4, 5, 6, 7, so that might be 7 to 9. That means they are high likely to the reason of severe risks. That means we have to do a proper nursing intervention to avoid the probability of Braden scale probability of pressure injury for this older man. So this is how we have to do the critical thinking and do the assessment. And I just give you a quick overview of how and what exactly Braden scale is and how important it is in nursing field. And please let me know how is the video. I will make another video on Braden scale and how to chart it. Thank you for watching.